mine. I show it's 12:01. So Lucy, you want to start?
Hi. Sure. Hello. Hi, this is Lucy Robbins, and welcome to the Reality Therapy Corner. And I'm broadcasting today from the Starbucks patio because, as usual, I have no internet on the very mornings that I need it. So I'm glad to be here with you all. The Reality Therapy Corner meets the last Thursday, what is this Thursday? Tuesday of each month to discuss reality therapy and the impact it has in our world and our therapy and all of our lives. And each month we have a different featured guest to help us with our video. And we do still need some people for future videos. So if you're interested in being one of those featured guests, please get in contact with me or Vicki Harris, and we'll get you into the schedule. This is a conversational collaboration, and we want you to add to the conversation. And it's sometimes difficult on a format like this, but we'll recognize that you're not talking over us on purpose, but that you're trying to get your information in as well. And we appreciate that and want it to happen. Our featured guest this week is a friend of mine, Dr. Bob Wubbolding. I met Bob in 1990 when he was at that time the educational director at the William Glasser Institute. And for a long time, I didn't think Bob liked me. He kind of ignored me.
I still don't.
He still doesn't know. Well, I know that's not true because just a few years ago, sit up straight and tall, Bob, see his shirt with the WDEP on it. He gave me one of those. And then I knew I had made it into Bob's liking world. I finally matched his quality world pictures and things. So we're real excited to have him here today, one of my favorite people to learn with. So Bob, take it on for us today.
Well, okay, thank you. You know what those 4 letters mean?
I do. What do they mean to you?
Means women do everything perfectly.
Absolutely. That's
also
why
means,
I got the shirt.
It also means whining does eventually pay off.
Oh, okay.
Mike Fulkerson has one.
And when in Owensboro, it means when does Elvis perform?
I see Maureen McIntosh. I hope everything is okay up there.
There's a lot of devastation on the shores, Bob, but personally, we're fine. We had a few branches down, but that's it. But along our shores, there's a lot of homes lost and things like that. So.
All right. All right, let's get started. I'd like to acknowledge every person and say hello to you. I don't get to do that very often. But hello, everybody. And my name is Bob Wubbolding. And the accent's on the first syllable. Somebody said you don't say the name, you sneeze it. So I don't know. But what I'd like to do is enumerate several points. I wrote down several. I wrote down 7, actually. And but feel free to jump in and interrupt and talk and disagree or agree, whatever you care to do, or elaborate. So thanks to everybody who had a hand in setting this up, especially Lucy, especially my friend in Shelbyville, Indiana. And we'll get started here. All right. So I'd like to just say something about acknowledging Glasser. He is the founder. He's the one that we owe so much to. And I want to just say that something about his legacy. And what did he leave us? Well, one thing he left us was choice theory. Another thing is reality therapy. Another component of his legacy would be his institute, which we are all committed to, which is doing, I think, when the founders of these organizations die, sometimes when the founder of the theory dies, the organization dies, but this organization it does struggle, but it's going along pretty well. And there's people giving their hearts and souls to continue the organization as well as the ideas. So one of the things he gave us too was a process called change. And he continually changed his ideas. So it seems to me that as we go into the future, we need to balance constancy and change. Constancy means looking back at his teaching. Change means building on it and looking into the future. So we need to look out the front window of our institutional car, but we also need to keep an eye on the rear view mirror. So when we emphasize one over the other, that will be not such a good thing, at least in my view. Okay, so but there are changes that we've made. I have an idea that here's a change for consideration. That's all it is for consideration. That he said all behavior has a purpose. So we can't generate a behavior without it having a purpose. So wouldn't that mean perhaps that we have a need for purpose and meaning? And so that's a possibility. We've done quite well with the 5 needs that we have, but I'm just saying that that's the possibility that we have a need for meaning and purpose, as Viktor Frankl pointed out. Another point is for the future.
We're gonna do, Bob, can we take
What?
them point by point?
Well,
Because
we'll
I'd
never
like
get
to
through-
say something about that one.
Okay, go ahead.
Well, I say that all behavior is purposeful, and the purpose of all behavior is to match a quality world picture in our real world. So I don't know that it's an extra need or not.
Okay, well, maybe
Process
it
rather
isn't.
than need.
Maybe it isn't. I'm just saying that's for consideration. Anybody
Okay,
else want to comment?
well, maybe go ahead with the 7 and I'll keep my
Well,
comments till
I
the
think
end.
what occurs to me is that we're looking at, those are 2 different types of purpose,
Yeah,
2 different uses of the word purpose. So, when we're looking at purpose as a need, that's different than just
A reason.
considering what's the word we're using there? It's not a verb, but noun, pronoun. I don't know.
Not
What-
pronoun, but noun.
A good
What-
question to ask clients and to ask institutions when we teach this is, what purpose do you have? What is your goal? Or especially in school, when kids get in trouble, what were you trying to accomplish? Now that could be power, and I know that, but you could also, factor it into that. This could be a purpose that you had. A purpose. What was the purpose of that? And usually they don't know. And sometimes in institutions, we don't know the purpose. What's the purpose of a university? We can argue that.
Isn't that all part of process, Bill? I mean, Bob,
What?
isn't that all part of process? In other words, you go through a process which includes choice theory and all the various aspects of choice theory, but purpose is actually a part of the process in choosing and motivating in your
Yeah.
motivation.
But it could be we go through that because we have a need for purpose.
Well, is purpose your ideal quality world picture then? Because that's what we're trying to match.
Oh, could be. I mean, I'm not going to answer this like I know it.
Well, that's what we've got you here for.
Oh, yeah, right. That's not,
Bob, the first time I heard you say that, I thought to myself, I've been thinking about it since, and I'm just wondering, how would you measure the strength of that need for purpose if it were in fact a need?
how do you think?
I've just been mulling it around. I'll put it out there for what it's worth. That's all.
Well, I don't know how you do that. I don't know how you measure any of them. There's all kinds of tools, but these are pretty fluid ideas. And
Yeah, yeah.
They're very hard to quantify.
Okay, we'll
Anybody else?
Keep
try,
going, keep going, keep going.
keep going.
All right,
We'll try
another
number
thing
2.
is, and I have this idea of, can we ever make peace with it, with diagnosis and with what Glasser called the big book of unhappiness?
Yes,
Can we make peace with this? There's a new one out, by the way. It came out in
DSM-5,
March.
okay.
It came out in March. I don't have it yet. I'm waiting for somebody to give me one free, but but can we make peace with it? I encourage everybody to take out your DSM, not right now, because I doubt if everybody has one, but let's just take a look at one of these diagnoses. How about just randomly, I'll select one, PTSD. How do you know, what are some characteristics of it? Irritable behavior, angry outbursts, reckless and self-destructive behavior, hypervigilant, exaggerated startle response, problems with concentration, sleep disturbance, okay, etc. Does any of that have a relationship component, do you think?
Absolutely.
Absolutely. Like, you can go through that thing and you can't find a diagnosis that doesn't have a relationship component. So by make peace with it, I don't mean we have to worship it, but we have to use it. People in the real world have to use it. I've taught counselors for many years in the universities and elsewhere, and they can't escape it. But doesn't mean we have to use it a great deal in our work. Okay, any comments about that?
Jeff retired from doing psychiatry. He made peace with it. He dumped them all.
Well,
It was one of the books we
Well,
didn't move.
Right now, Bob.
I think it, oh, I'm sorry, is somebody speaking?
somebody's on the phone.
Go ahead, John. Go ahead.
Jim.
Yeah, I think that it's a very important question because this is probably our biggest criticism from outsiders. And causes, probably the most headaches for us. Back in the early 90s, when I started with this and I started doing presentations, I can remember I've always had this one presentation that just stood out in my mind. And it was a hospital in Hendersonville, North Carolina, at the hospital there. And it was a lunch and learn. And I literally just got up after they introduced me and basically said, my presentation was on choice theory, reality therapy. It might have even been control theory, but it was already choice theory, I guess. No, we hadn't changed it yet at that point, I guess. But somebody stood up in about the middle of the room, a young lady, and she was very angry and upset that we were talking about a theory that discounted psychiatric diagnoses. And that and basically she went on for the entire lunch and learn and we could not interrupt her. So it was, and it's just we get it in a lot milder forms, but I think it's a very important question for the entire institute and to have something formal on it in that sense.
I'll look her up in the DSM. I'll look her up in there. I'm sure she's in there. There may be a picture of her in there for all we know.
Well, it might
That's
be.
right.
But I think the DSM is useful and helpful in some instances, and certainly the most significant way that it's useful is with the billing system. We don't have another billing system per se.
Well, one thing we're seeing with community mental health is that it seems to be catching up somewhat with reality therapy in terms of treatment planning, because the person-centered recovery movement is an evidence-based form of treatment planning, and that's how it differs from traditional treatment planning is emphasizing that input from the client direct the treatment plan rather than the diagnoses.
Yeah.
So I think the world's catching up in that respect. As the world, I know the graduate schools are a little behind. They're still not. I think they're starting to catch on to the person-centered recovery planning movement. But as that goes along, I think the rest of the world is going to come along with us, and diagnosis being seen as important for billing and describing behaviors, but not necessarily. And also it gives some help maybe in identifying interventions that may be helpful with particular diagnoses, but not the main guiding force behind the treatment plan.
I think for
No.
me, it's the labeling and the naming of, and making people groups of people rather than looking at the behaviors that cause that label. I wouldn't want to give up not labeling people, because that is not building relationships. That's exclusive rather than inclusive. But there, I can see all the points about billing and that type of thing, and that the behaviors are real, that they're common enough that we can group them together and give them a name.
I think your point is well made, Lucy. I think Mike has several points as well. One that I kind of wanted to emphasize, Mike and I had a conversation and we were discussing the evidence-based concept, and Mike discovered the 2019 article that where it describes the federal government as shutting that system down. So I don't even know at this point if we can legitimately use the term evidence-based anymore. Is that a shocker to everybody, or? I mean, that lens, and I think our discussion, Mike, correct me if I'm wrong, but I think our discussion was that this kind of supports choice theory in that context.
May I ask a
Well,
question?
sure.
May I ask
Sure.
a question?
Absolutely.
Jim, could you specifically say why you suspect we might not be able to use that term evidence-based? What is the core specific reason in your mind?
Well, I'll say this. Thank you for the question. Two points. One, when I first heard that term, what had occurred, I think I was not long out of grad school, and what occurred to me is that the idea of evidence-based seemed somewhat irrational to me. I couldn't imagine in my mind how you could come up with that. And what I think that article was stating was that the research was flawed, and that you basically would have a very difficult time coming up with, significant research that could be spread across all deliveries, modes of delivery, different types of therapy. So even to say that, well, for instance, I think the primary one was, I think a research article that had been done on motivational interviewing or something like that. And it was very specific to an area of addiction treatment. And then it was generalized after, it started getting, just by word of mouth and use and so on and so forth, it started getting more and more generalized. But there's not really a significant body of research that supports any of these types of theories. And so what had occurred, I think what, the imagination comes up with right away, and what actually occurred is that when you try to have that kind of system, you're going to include things that aren't necessarily working, right? And you're going to exclude things that are working. And that's a huge problem. I think that has been the crux of what has occurred in the mental health field in general. And then that particular season of language added to it. So.
The
Well, Bob,
American Psychological Association says to call something evidence-based, you need at least one experimental controlled study. That means you have a group where you use the treatment and you have a group where you don't use the treatment. And there has to be a statistically significant difference in the outcome. I was surprised when they said you only need one. And
yeah, it doesn't make sense.
That's what they say, but it's very difficult in our field to get a group that we use reality therapy, and then a group where we don't use. Maybe we could do that in schools, but it's tough. These are practitioners also, and they don't want to do research. So, but that's what That's what they say. So, but I will say this, that we are well represented in textbooks. In fact, I have one here called Counseling and Psychotherapy by Tony Tinsley, and a couple other people were the editors. And they say in there, and look what they have. They have reality therapy on the cover, which I was very happy about. And they say this is, these are theories that are accepted. There is evidence for them. They don't say evidence-based, but there is evidence for them. And these are widely used. So it's got credibility when we find it in textbooks. Especially, I suggest when you see it in a textbook, look in the beginning of the book and see what kind of theories they put in there, where they may have a statement, and that's very valuable. That's very valuable. Now, also the European Association of Psychotherapy for many years have endorsed reality therapy. Our professional organizations don't endorse specific theories except implicitly if they publish a book on it. But and APA has done that. They've published a book that I wrote, and so they had a series, and they asked me to write the one on reality therapy. But that's not the same as evidence-based. But we can say this, and I've checked with ethical writers, and we can say evidence supported. We can say that. We can say evidence informed. And I suggest we limit what we say about research and evidence to those statements. Now, if you want to say evidence-based, because there's people in our organization that say, no, it's evidence-based, but I would suggest to be more cautious than that. And, but you know, you'll do what you want to do. But that's just my suggestion. And
I think another one that came up years ago that you might recognize, and it might kind of add to the validity of the discussion, is that when you were having conversations or when people were making presentations, they would always use this term or this phrase of research. What is it?
Research-based?
Yeah, research-based, research supports, research shows. Oh, research shows.
Yeah.
And I got tired of hearing it from one particular colleague one time, because every conversation that he had, he was trying to convince somebody of something, and he would always use that term. And I finally looked at him and I said one day, you know, what research? Can you point me in the direction where I can look at this research? And of course he, you know, no research. And, you know, so that was like, you know, just, it's kind of an irrational aspect of presentation. You're just trying to, you know, use some kind of philosophical vice or something that, you know, this phrase catches it and you should accept it just because. And that's kind of what I tuned into with that thing. So.
May I?
Albert Ellis claimed that he had, every time you hear him talk, the number went up by about 500. He said there were 500 studies that validated his system. Next year, he'd say there's 1,000. And finally he died. But he always claimed there was all these studies. I don't know. I mean, I don't think he'd lie, probably. But who knows?
You know, there's a lot of interest. There's
Nobody
a lot of
lies.
interest in this one. Maybe
What?
we ought to get somebody to volunteer to do this again. There's a lot of interest in this subject. Maybe
Yeah.
someone like to do a whole session on this. Just
May I make
volunteer.
Jay, what were you going to say?
I'm going to make a comment to put in the parking lot, which is evidence-based is a relative term, and it exists in values that are different when it's outside of a clinical environment. So in my work, when I say evidence-based, it means something completely different. And if I didn't say evidence-based, or if I said evidence-informed or research-informed, it would dilute the integrity of the value. So the value of the words change depending upon the environment that they're being used in and the understanding. And the purpose for my making this statement is twofold. First, to create a distinction, and second, that I'm not a clinician. I don't plan to be a clinician. I don't have any licensing at all, but I operate within businesses and corporations, private, small, and enterprise level, local and global. And therefore, having to conform to a psychological language set when I'm dealing with corporations who wouldn't even want that would be a marketing hit. So just to keep in mind for what it's worth. Thank you.
Somebody
Okay.
has their hand up. Who's that? Okay, go ahead, Bob.
Well, I just throw that out for consideration. And I think we need to, my thought is under promise, over deliver. And I've heard people make statements about quality schools that, oh, if you have a quality school, this will never happen in it and all that kind of stuff. Whatever it is, it's going to happen anywhere. And regardless of the wonderful system that we have, there's going to be problems and antisocial acting out and people flunking in school and so on. So I suggest we temper our language a little bit. And maybe maybe that would be good, because the quality school, for example, has not exactly been a rip-roaring success. I think there are 2 of them in the United States. Is that right? Anybody know that number for sure? There were 20 of them, but something happened. I don't know, hurricane or something. And
Is Kay Mentley's Traverse Academy still active?
I have nothing to say about that
Yeah.
place,
Okay.
so I don't know.
Okay.
The last I do have something to say. The last I heard is that they are trying to reinitiate the quality school program.
Oh, yeah.
Anybody else know something about that? Lucy, I bet you do.
No, I just know about Steve's school and St. Patrick's,
Yeah.
and that's an active teaching choice theory, reality therapy, living it kind of schools, just what Glasser sort of envisioned, I think.
Yeah.
But the
No,
new
one other,
administrator
I
is
think-
having to learn choice theory.
Mhm.
Yeah.
Well, we can teach her.
Yeah, that's right. Absolutely. You can teach her.
Okay, one of the things I would like to see happen, and one of the things I've dedicated my professional life to, although this isn't the only thing I do, but is to mainstream reality therapy, is to get it in the mainstream. And when we get it in the mainstream, we have to watch how we present our ideas. If we overpromise and we criticize too much other systems of education, of counseling, that undercuts our credibility and it hurts in the long run. So, but it's in most of the textbooks, and it's the European Union, as I said before, has actually endorsed it. And thanks to the work of Leon and Boba and John Bickel and all kinds of people in England and continental Europe also. And when they first endorsed it, they wanted to know, is it represented in textbooks? That was one of the questions, not the only question, but it's certainly one of them. And it is. So Glasser originally wrote a chapter in Corsini's book, Theories of Psychotherapy, I think it was called then, and it's since been dropped by Corsini when he was alive. And so, but he wrote the chapter in there, and then there was another chapter that he and I wrote together, and and that was met with, I think, some success. People liked it, but it's not in that book now, although it may be when the next edition comes out, which will be a few years. Okay, I see a number up there. Does that belong to anybody?
Well, the reason we have this reality therapy corner was, I agree with you, Bob, it needs to be mainstreamed. And the Institute didn't even have a video or too much information about reality therapy on our site. So now we're actively doing this monthly to continue to get the information out about reality therapy.
Good. Okay. And you said reality therapy. That's very interesting that you said that, because there seems to be a trend toward not saying reality therapy as much as choice theory.
Uh-huh.
And the way I explain the difference is that choice theory is the theoretical, it's the ideological basis for reality therapy. So there's the theory, there's the practice, and the third component is research, which we've already talked about. But what's the difference between theory and practice? I'll illustrate that. I have in my unsullied hands, never touched with nicotine, is a rubber ball. And I will do something with that rubber ball. I'll drop it. Now, what did I do? What was that? What did you see?
Let it go.
Pardon
You
me?
just let it go.
Yeah, and I dropped the ball. No. Here's what I think. I was practicing gravity.
Uh-huh.
Does anybody talk like that?
No.
They said it was dropping a ball. They were talking about the process, not the explanation of it. Gravity explains what happens. And choice theory explains what happens. So it's just a little point of distinction that may have some usefulness. And for me, it has a lot of usefulness, but I'm not saying it's useful to everybody. I would never say that. Any comments about that? John
I think
Morse?
towards
Oh.
towards the end of Glasser's life, he was really promoting choice theory. He wanted that to be the legacy.
Yes.
And he talked about living choice theory. He talked about a choice theory marriage. He did the book Counseling with Choice Theory. It was his vision that would supersede reality therapy. I don't see that there's a need for one to be greater than the other. I think
No,
I like the idea that reality therapy is the method and choice theory is the reason. It works
But
for me.
if you look at the chart, the color chart, Wendell, you had a copy. I saw it when you were up for a moment. You had it visible. The color chart says what at the top?
Says how. Is that what you're looking for, Bob?
How the brain works.
Yeah, it says how
How-
the brain works. It's an
How
explanation.
the brain.
As you looked a little bit lower, you see situation A. And what does that say?
Gaining more effective control.
What's it say?
Gaining more effective control.
Not situation A. Situation A
Being less
says
Not
Oh,
now
yeah,
in
like-
effective control.
No, yes, I
not
did it
effective
backwards.
control. So we always are living choice theory, whether we're antisocial, psychopathic, serial murderers, or at the bottom saints like Lucy,
Yeah.
yeah, and other people. I don't include myself in that. But you know what I'm saying.
did.
And this is again, I don't propose anything here with absolutistic certainty or immutable truthfulness. I'm just saying, I know he said the choice theory world, but his own chart said we're going to explain even hostile, negative, ineffective behaviors with that choice theory chart. So it's a
Dr.
thought.
Bob, we have someone
Yes.
have their hands up.
Pardon me?
We have someone with their hand up.
Okay,
Yes.
okay.
That's Tobeka. Thank you very much, Dr. Bob. It's Tobeka from Cape Town.
Oh, welcome.
Yes, thank you. I just wanted to just add a little on the difference when you asked what the difference is between choice theory and reality therapy. I immediately thought of an example of a therapy, your DBT, dialectical behavior therapy, which is like you have correctly put it, it's a practice that is used by clinical psychologists to support somebody who is unfortunately also in that DSM-5 thick book, has been labeled already, and is going to be equipped with skills to cope with whatever condition that they have been diagnosed with. But what I'm trying to say is it could be backed by some theory, which in my case would be choice theory, and therefore we use choice theory to support or to practice, let me put it that way, as a form of practice, but with that backing, with that knowledge of choice theory, then we behave in a particular manner so we can improve our relationships and also help others improve their relationships by understanding the theory first and therefore applying thereafter.
So are you saying that choice theory is quite compatible with DBT?
Not necessarily. I was just making an example. I was simply making an example that it's just the difference between theory and practice, or rather theory and therapy, if we choose to call it therapy.
Yeah, okay. Okay. Anybody else have any comments?
Well, correct me if I'm wrong, but I've never really thought that DBT was a theory.
No, it's not.
Yeah, and
It's,
one of the
it's not necessarily a theory, but it's a therapy that is used,
right,
backed by some form of psychological theories that were researched.
right.
I
it
think
borrows-
Wendell had his hand up too.
If I could step back for just 1 second in that idea of the professionalism and evidence-based, supported, whatever. When I was a grad student, we were told to choose a theory. One of the reasons that drew me to choice theory was that it had a journal. That was one of the criteria in our textbooks for, whether something was a legitimate professional approach. And I think it was the only one. I think choice theory was the only one. And, I traveled to do my master's paper. I actually traveled from Edinburgh to Kent State to get the journal out of the library so I could do my papers. And that's where I saw a lot of Dr. Wubbolding's articles in the journals was, there was stuff on installation of hope. There was stuff on suicidology and course approaches and so forth. So
I'll say this, whenever I go to conferences and I tell them that we have an institute and we tell them that there is a journal, this really does increase credibility.
So if I can put a plug in here for our journal work with, I think it's Tom Parrish. He needs articles. He sends out information. Please get in touch with him to see how you can help with our journal. We need to keep that alive.
Yeah.
I think Wendell had his hand up. I'm so sorry, Wendell. Go ahead.
Oh, no rush. Thank you. 2 or 3 quick things. One of the things that I've done, the book Choice Theory says, and we say choice theory, Glasser Institute for Choice Theory. The title says Choice Theory, a New Psychology. If I just say to people, I want to talk to you today about choice theory, I think there's a difference when I say, today I'm going to talk to you about choice theory psychology. That seems to feel a little bit better. Choice theory is kind of vague, but I like using choice theory psychology. And then it's interesting to me to look back at the original 8 steps of reality therapy.
Huh.
And is there anything among those that's different or invalid today because we know choice theory psychology? And I say no, except for it took me a while to change from saying make friends, since I cannot make friends, to being friendly or work to try to build a relationship. But those steps were there. Isn't it interesting how the archaeologists just kept digging and digging and dug up choice theory, which explained why reality therapy worked so well. So it was always underneath it what do you want and that sort of thing too. So the other thing, when I've gone to do training, I use that my job is not kind of a thing. My job today, I say, I'm excited about choice theory psychology and reality therapy, but catch me, I don't want to say this is the only thing in the world. This is the very best thing in the world. It's just a very good approach and a way of working with people that's very helpful. And my job today is to share that with you. And then you decide if there's any parts of it that you want to take away or add in for yourself. But that way I'm not competing against what they already know and believe in. And I'm fairly savvy about connecting the other major psychotherapy approaches, the differences and the similarities. So I'm not trying to say this is the way, and then people don't get defensive. And if they ask about Adlerian or cognitive or one thing or another, I'll tie in, wherever they overlap in the Venn diagram. Thank you very much. See my note in the chat room, all of you that I don't know, and please send me your email address. I've got mine there.
I like to start off when I teach this to new groups is to say, this is a motivational system. And I try to avoid terms that they might not understand or might not like. And this will explain why people do what they do. Did you ever wonder why people do it? Why does that kid do that? Why does that employee do that? And they all, yeah. And this will help explain that. And then we're going to talk about how to deal with that. So I just said choice theory and reality therapy without using those terms. And as it develops, then they'll take it on board. Oh, choice theory, yeah. But another comment I'd like to make is that the brief therapists, I think they're still around. Everything's brief now, but the solution focused, when they first developed those ideas, they took great pride in not having a theory. And but what we have, we can contribute a theory. An author of one of the textbooks said, reality therapy, he meant the whole system, is one of the few that distinguishes between theory and practice and has a clear demarcation point between them.
I want to recognize and appreciate, Wendell, the clarity that you brought to your comments, as well as what Bob has said, because again, I don't want this to be about me, but when we talk about this in a larger context outside of a clinical one, and we go into the business world, a talk of psychology, I don't use it because it gets people really squirrely. And I absolutely, and so I'm not saying either or, Wendell, I appreciate your points. I like what Bob has said with regard to a motivational, what was the term, Bob, motivational?
The motivational system.
A motivational system. And this is particularly significant as, which you may all know, the use of the word system and the discussion of the word system as applied to therapy in terms of relationships, in terms of psychology, systems thinking, in terms of business is a foundational word these days. And a motivational system, at least for me, plays very well. If I went into corporate calling this a psychology, and again, Wendell, I'm not disparaging at all what you said. I appreciate all of it. I'm just wanting to emphasize that if we're true to what Bob's objective is, which is to expand, then we have to consider the language as relative to the environment that we're in.
Absolutely.
Yeah. Ron, how does that apply to your work in the ministry?
Oh, Well, it applies completely because the motivational system has to do with relationship with their individual faith perspective. And when I'm trying to counsel an individual, say, who is approaching the end of life, I first have to learn what their faithing system is about. Well, where are they? What is their motivation to reframe dying? And once I discover that they happen to have a Christian motivation, I am able to reframe it with them in terms of their belief.
Are we there?
So that dying becomes looking for the future, looking towards the future, rather than the end of life and the end of thought and the end of what my motivations might be.
Do they really, and I think I know the answer, but does it sink from their head to their gut? Are you able to help them be at peace? Because death to me is really scary as hell.
Yeah. I had a nurse come to me who has just received her RN and had her first patient die, and she said, "I can't do this anymore." And I looked at her and said, "Wow, what do you think about dying? What is in your mind about helping people through this process of the end of life?" And she didn't have an answer for that. She says, "It's just an end." And I said, "What's your faith background?" And she told me she was a Christian and this sort of thing. So we began to discuss a little bit about what is the future. What do you anticipate will happen after you die? Does your soul continue? And if it continues, does it continue in the presence of the familiar, in the presence of loved ones that you might meet in heaven, or meeting the great figures of scripture like Jesus himself? And after she went through that with me, and we went through that together, we determined that actually it is a tremendous honor to be able to be present at the moment of a person's passing. And that's something to really, really look forward to. And consequently, I couldn't do this work if I didn't have that vision. But see, you can deal with the work of Randy Alcorn, who's written a very thick book on heaven. And this book describes all the various verses in the Bible that refer to what heaven is like and what happens in heaven. That is very helpful. The 50 Days of Heaven is the best because it's a short devotional. But if you're dealing with individuals that are non-Christian, then you can look to the work of Elizabeth Kubler-Ross. And that seems to help too, because it regrounds them as to what they can envision, how they can reframe death and so on, as to something to look forward to, something to anticipate.
You know Woody Allen's famous quote about dying. He said, I'm not afraid of dying. I just don't want to be there when it happens.
All right. Okay.
Speaking
Thanks,
of
Ron.
Speaking of reframing death, there's actually an end of life festival happening in St. Louis, which we're going to be having our conference next year. There's an end of life festival going on next month.
I didn't know about that. My
Yes.
End of life festival?
Yeah, I got that information from a friend who's actually a death midwife, and that's exactly what she does, is help people reframe death.
Yeah.
Mhm.
Very interesting. Very interesting. Wow.
Yes.
I would make I've enjoyed, Ron, have you seen Lutzer's book, 1 Minute After Death? Something like
I
that?
have not read it. No.
It's excellent. It's a thin book, 170 pages or something, small one, but really, really good. Yeah, I don't know if we're ready to move on to new concepts or anything, but I have a question I'd like to get on the record for Dr. Bob.
Oh, Jeez, I'm nervous already.
Yeah, Bob, you have about 10 minutes.
Okay.
So do you, now I mentioned this to a couple of people, but several folk, one or two folks said they did not remember when you were setting up a role play that you would make a comment about no impossible scenarios. Do you remember that?
Probably, yeah. I wanted them to be easy.
Yeah, well, I remembered that almost every time you had done, I'd seen you do role plays. I remembered, you know, in the early years, I remember seeing you do that. But I want to pose this as a particular concept significant to choice theory. Because I don't think choice theory supports the idea, and when clients come in, choice theory does not support the idea that there are impossible scenarios. And it does support the idea that there are not impossible scenarios. And I think that's particular to this theory. I think it's a direct part of the theory. I think it's something we've alluded to for a very long time, and the whole concept of choice formulates that. So that's my 2 cents.
I think
Hey.
we can address any issue with reality therapy based on choice theory, but I follow Glasser. I heard him say, you know, there are people that are beyond the help of any other human being. So, I mean, I'm talking about Charles Manson. Would you like to counsel him? I mean, some people are beyond, but you don't know that. I mean, you don't know that. So I would just assume that everybody can be helped, but this isn't going to touch everybody. I try to set up in my trainings, in group demonstrating group counseling. I try to set up, I say, give me their worst person, 4 or 5 worst people you've ever met. And they get up there and they won't do it because you can kind of take the British say, take the piss out of them, but it means, it means you're not going to allow their control need to overpower you. I had one woman recently who did finally say something that was pretty tough to deal with. She says, I want to know what a white male straight has to offer me, a woman. And I just said, I don't know, maybe nothing. That kind of eliminates. And I said, well, we'll get back to that. And, you know, but sometimes being humble and recognizing one's limitation is a very effective way to engage with people.
I like your example of Charles Manson. I would suggest that nobody ever introduced choice theory to Charles Manson, and that it might work. But Son of Sam, which you may recall,
Oh, yeah.
there's a very nice aspect of him in a Gideon video where he has been teaching Christianity and scripture in prison system for a long time. He'll never get out of prison, but he's dedicated to Christ and to scripture in his presentations. So very interesting.
Well, that's where Christ is, in prison, because everybody finds him there.
Yeah, yeah.
Bob.
Yeah. Anyway, this whole thing about religion and spirituality is maybe looking in the front windshield of the car. Glasser said choice theory, reality therapy should not be a religion. Well, we're not saying it's a religion, but we're saying it has some implications that spirituality can build on.
Uh-huh.
I just want to make that clear because there may be some people that don't may not like this discussion. And I just say, well, there's a lot of applications, and this can be at the basis of many, many applications.
I've enjoyed Power's 10th order perception concept and don't want to give it up. I think it has a place.
Powers was the one of the people where Glasser got ideas on control theory. He had 10 levels of perception, and Glasser said that's too many. Let's who can remember 10 levels? So anyway, that's it. Okay,
Dr.
any
Bob?
other thoughts? Yeah.
I just want to, before we close out, we have about 5 or 6 minutes left, or maybe 4 minutes left, to remind everybody that Wendell Walker, who's on the call with us today, he is our next guest speaker with Lucy, October 25th, adding some spice and pump up the volume on your counseling skills. Oh, look at him. Go Wendell. We want to make sure that you sign up so you get the reminders. And then I also put information about the U.S. conference in 2023 will be in St. Louis, Missouri, July 5th to the 8th. We just make sure everyone knows about that so you can come, and we are going to do our best to have a hybrid session. Lucy, do you have anything you want to add at this point?
Oh, no, I was just getting ready to close up when Bob was finished.
I'd like to make one more point if I can.
All right, Bob, make
Please.
one more point and we'll wrap up after that
Okay,
point.
I want to make a point about personal responsibility. And it seems to me that that concept is central to reality therapy. We say people choose their behaviors, and in other words, they're responsible for their choices, for their consequences. And I just think there's a danger of that being lost in our profession, in our whole profession, where a person's behavior is not due to anything that they choose. In fact, if you said people choose, you'd get in a lot of trouble in some circumstances. And I think we ought to be courageous enough to face that. And are we still on?
Yes.
Yeah.
Okay. Because without personal responsibility, society breaks down, according to a lot of thinkers. And we ought to take a stand for that, which we do implicitly in our teaching. So a lot of behavior is attributed to them, or our history, or somehow our legacy or something. And we have all these words in the profession and with the people that I hang out with, which are mostly not in the William Glasser Institute. And so there's a lot of excuses. I'd call them excuses. They're good excuses, but they're still excuses. Anyway, we say they choose it. That's all I got to say.
Well, Bob, thank you very much. You gave us a lot to
Thank
think
you.
about today.
Thank you.
And in fact, you didn't get through your list. Maybe you want to sign up to do it, the rest of the list later on after the
Please.
first of the year.
Yeah.
We would
Well,
love that.
Mhm.
Okay, well, we'll wait a while on that.
All right, we've got Wendell next time, and he'll get us stirred up and visiting. I love the way people jumped in and added
Yeah.
their parts. It was a good conversation today, and I hope we can continue in that process. So thank you all for signing in. Tell your neighbors and friends to join us next time. It'll be the next one will be with Wendell on October. What's the date, Wendell?
25th.
25th. Okay. And
Thanks to Vicki and Lucy. I just want to extend my gratitude to both of you.
Well,
you're
thank you.
welcome. We're
I'll
really
be-
excited that we're talking about reality therapy at the Institute again.
I'll be here on October 25th unless Hurricane Ian blows me away.
Okay,
Yes, right.
if so, I know
It's
he's going to be
coming tomorrow
talking
night.
about techniques and things we use to help promote and teach reality therapy. And he wants you to bring some of your best ones along with you to share.
And Wendell, if you need a place to come stay for a couple of weeks, come up to Indiana. I guarantee you there'll be no hurricane here.
No hurricane in that town.
Just
Not here.
potatoes.
Yeah, just tornadoes. Sorry. So thank you, everyone. The counseling committee thanks you for joining us. Please take care, everyone. Stay in touch. Let Dr. Bob
Thank
know
you.
if you need anything, want anything. Thank you, Maureen. Thank
Thanks,
you,
Maureen.
everyone.
Jay
Hey.
Steve.
Signing off.
Bye-bye.
Bye.
Bye.
Sayonara, adios.
Bye. Good to see you again, Bob.
Did Did Bob take off? He
He
did.
did. He did a
Okay.
great job today. That was a
Yeah.
good conversation.
I need to
Was.
stop the video.
Stop the recording.